Well, thanks so much, Peter, for inviting us to be here. It's a real pleasure to come to Darwin. Always love coming to this part of the world, and it was a real pleasure to be asked. And I think we had a conversation last year, but unfortunately, I wasn't allowed to leave the state last year. But it's a real pleasure to be able to leave the state and fly up here and spend the day with you. So let me take this opportunity to also acknowledge traditional custodians of the land on which we stand, the Larrakia Nation. Pay my respect to elders, both past, present, and emerging, and really, again, acknowledge the incredible leadership and knowledge that you hold. And I think we've got a lot to learn. And the topic I'm talking about today, which is around the power of real stories, I don't need to tell, people, how powerful stories are. And I just really want to take this opportunity to really take us back and think about, well, where are we at, like in terms of trying to make progress in this area, which can be incredibly frustrating. We're all very good at identifying the multiple problems that there are to fix. So the question is how can we come together? What can we learn? And there are incredible stories out there. And I think as I talk through sort of what we're trying to achieve at the moment and where we come from and the challenges we face, I think it's also important that we also take the opportunity to focus on the incredible work that we are all doing and thinking about how we tell those stories much more positively. So I'm going to talk about how we change the conversation and why we need to change the conversation. So I think just in terms of a history lesson, I think it's really important to, as the people in this room would know, humans have been sort of using substances to change their mental state since the earliest of times. It's part of human culture. So we have sort of records going back 8,000 years around alcohol being used for recreational purposes, for medicinal purposes. We have psychoactive substances like mushrooms and other hallucinogens being used in ceremonial services for cultural significance. And we have a whole history around the medical use of cannabis and opioids, going back thousands of years, as the key role in human civilization. So drugs are part of human experience. And I think it's really important to note that, because when we talk about drug regulation, that's sort of a relatively newer phenomenon. And I think we need to sort of bear in mind sort of our framing, because this is our reality, but it's also important to see that broader context. So when we think about drug regulation, I think we all like to think about, we live in an evidence-based society, so we like to think about that our response to drug regulation of some form is the idea that it's motivated by the prevention of harm. But I think the history of drug regulation is really about it being motivated, as most people in this room would appreciate, by political and economic factors rather than the actual how harmful a substance is. And it's often driven by this idea of moral panic. So when there's broader concerns around the economy, public identity, and fear about upholding moral norms, we see this moral outrage. And I think, in contemporary societies, there's a few other examples of that we see in terms of our discussion of refugees and others, in terms of how we frame the issue. And I thought it was really important, I think, hearing about some of the challenges in the territory and around alcohol, just to convey the story of, I suppose, one of the first sort of drug campaigns in the 18th century in the UK, all about sort of the gin craze of the 18th century. And so what we had gin being imported into the UK. William and Orange was king, so for Dutch origin, gin coming into the country. What we also had is a major industrial revolution, so we had people coming dislocated from regional areas to come into the city, into slums, where they're disconnected from their family. They're living in unstable housing, lots of poverty, lots of insecurity, lots of crime. And what happened was there was a war in Europe. They decided to increase the taxes on the gin being imported. There was also a really poor grain harvest, so a lot of the landowners in Parliament lobbied very hard for their grain to be used to make gin. And so what we had is this abundance of cheap, poor quality gin that was available to the masses, and we had this explosion of a public intoxication. And the narrative at the time was the outrage around this public intoxication was it was people of lower class, people of lower rank, who were sort of immoral and were driving this, and something had to be done. So I think there's a lot of parallels there in terms of how we think about intoxication, public intoxication, and some of the drivers behind that. And so here we have two beautiful lithographs by William Hogarth, the artist, two different, I suppose, drug campaign pictures. So on the left we have Beer Street, where we have good, hard-working British people enjoying a good beer after a hard day's work. We see the pawnbrokers, out of work. Everyone's happy and healthy and enjoying good old British beer. And on the left we have Gin Lane, where it's in a slum. We have everyone, scenes of debauchery and depravity, people dying, mother unable to look after her children, the skeletal man there who's died, and then we have the pawnbroker in the corners making a fortune, people selling their wares, so a cook and a carpenter selling their wares to get the money for gin. So I think, we often struggle with thinking about how we deal with these issues today, but I think, this is an issue that people have been struggling with for hundreds of years, and the framing of it is really important. And so it's often the drug itself. So we had the Gin Act of 1751. So it's actually, the focus is on the drug, not the underlying social, economic and cultural issues that were driving that phenomena. So when we think about prohibition, it's also, really important to say that prohibition really came out of the temperance movement, the 1920s and 30s. So it's only really the last 100 years that we've been talking about prohibiting drugs. And really that sort of galvanised in around the 1970s and 1971 with Richard Nixon's campaign on the war of drugs. And what's really important was when you look back at the history books and you ask what drove that, a lot of his staff, people who worked in his office, talked about the crusade that he had against the anti-war movement, the hippies, the idea that pacifism and was seen as a great enemy of the state, and also around the whole movement around the black movement and equality and civil rights. And so, Nixon acknowledged that he couldn't go after the blacks and couldn't go after the anti-war movement, but what he could do is he could target things that were commonly used in those communities. So in the case of the anti-war movement and the hippie culture, cannabis was seen as something that was legitimate to go after. In the black community, it was heroin. So he introduced these laws that which was essentially racist and which was focused on disrupting the anti-war movement and the black community. And it was targeting those drugs and disrupting their leadership and making sure in the mainstream press that their ideas were sort of vilified and they were seen as enemies of the state. So a clear campaign to use drugs for sort of political gain. And because of the power of the US, obviously what we've seen over the last 50 years, the adoption of that war on drugs, across most of the world, and we're paying the price of that sort of really punitive drug policy ever since. So when we look at the history of prohibition, if we had a Martian come down today and they ask us which drugs are legal, which drugs are not legal, it's really very confusing to actually have a logic of what it is. We know from a whole range of studies that alcohol is the most harmful drug we have, yet it's legal and celebrated. We have conflicting messages about cannabis. We see in North America and other countries now the legalization of cannabis. And then again, we have this sort of, illegality of psychoactive substances, of the hallucinogens, and yet we see a whole movement now around the use of hallucinogens, ketamine, psilocybin, MDMA, for the use in the treatment of various conditions. And then we have other drugs that remain illegal. So even though heroin and cocaine were sort of the key components of medicines in the early part of the 19th and 20th century, we see them constantly being vilified, and MDMA, which we know is, as we said, ecstasy being used in psychedelic trials, again sort of highly criminalised, sort of for personal use. So we have this really confusing sort of constellation of approaches to prohibition. And as I said before, a lot of what we see in terms of how we think about what is prohibited and what isn't prohibited is around that politicisation of drug use. And it's often about fear-mongering, it's often about economic climate, particularly around things like immigrants and people who are seen as outsider groups, and targeting the drugs they use as a way of addressing that concern in the community. So it's about fears about race and social change, and drug use being that symbol of transgression. So examples are, in the early parts of the 19th century, Chinese immigration, both in Europe and elsewhere, taking the jobs of locals. And while both the local community and the Chinese community used opium, it was using the focus on that the Chinese are bringing this opium and they're corrupting people in the community, using that as a way of attacking and persecuting that population. And similarly, sort of the US, you saw after the revolution, 1910, and the war in Mexico, Mexican immigration, again, creating concerns around how that's impacting on American culture, leading to a whole fight on marijuana, and then, as I said, in the Nixon era, about pacifism and counterculture. So that's the context around how drugs are framed, and then it's not surprising then when we go to mainstream media, all we hear is sort of bad news stories. So constant negative stories that are pervasive and generate basically moral outrage. So biased stories around crime, deviance and immorality. That's what we hear in the mainstream press when we talk about drugs and alcohol. And we have these stereotypes that reinforce and perpetuate stigma. And if you look at research that looks at news stories in Australian media over a number of decades, what you see is particular drugs are sensationalised, so particularly drugs like amphetamines and heroin, sensationalised and a huge connection to immorality and crime. And then other drugs, for example, cannabis or alcohol, much less press that you see in mainstream media. So there's a real targeting and this sort of constant conversation about how bad and immoral these drugs are. When we go to sort of the film industry and entertainment media, it's not so pervasive, but we see these common stereotypes. We see the story of the tragic hero. So somebody who's struggling with addiction, who has a backstory of trauma, who successfully recovers and then ultimately relapses or dies. That story of that tragic hero. We have the story of the rebellious free spirit, so those people who are sort of counterculture, typically using recreational drugs, enjoying themselves to excess. We have the demonised user, the people who use drugs become dangerous, who become violent, who become unpredictable, reinforcing those messages around how evil drugs are. And then we have the comedic user, those people who use drugs to excess, that glamorise the drug use, that we don't actually see the negative harms minimised related to that level of consumption. And the issue with those stereotypes is that people who are struggling with alcohol and drug issues just don't see themselves in any of these sort of characters. So when they're struggling, they go, well, that's not me, so what's wrong with me? And so there's no one for them to identify with, and so it's struggling to know what's going on for me. And so what we see then is, in terms of this sort of 50-year plus history of prohibition and framing of drugs in this sense, it's not surprising that illicit drug dependence is the most stigmatised health condition globally, with alcohol dependence being fourth. And when we look at what the community thinks about this, is compared to other mental health problems, addiction is more likely to be seen as a moral issue, so a sign of weakness or choice. And then when we go to the community and we look at community support for various approaches, we see very low support for investment in treatment, investment in sort of evidence-based policies. It's very much framed in that stigma narrative. So when we think about that stigma, we can think about stigma at three different levels. We can think about it at the macro level, the meso level, and the micro level. So at the macro level, that institutional stigma, what we see is, we see, not to any surprise here, underfunded and fragmented services. So we see that addiction taking out of mainstream health, seen as being other, not connected to other parts of the health system. And, as I said, with the community attitudes towards addiction, what we see is that underinvestment. We also see people with lived experiences being not trustworthy or not seen to be able to provide sort of really good input into service design and program development or policy development, as we see in other areas. So we often see, issues that are where we see a lot of stigmatising language in government and organisational policies. We see very restrictive and coercive treatment policies, so very paternalistic approaches. We see lots of hurdles to expanding evidence-based treatment. Opiate substitution treatment is a really good example of that in terms of the barriers we put up to people in terms of getting help. They have to turn up at pharmacies, they have to meet all these different criteria, they have to co-pay. Lots of restrictions when we know it's a really evidence-based treatment that supports the community, but we can't expand it, and we see a lot of that regulatory barriers. When we look at the meso level within the healthcare system, many of the areas where we all work, what we see is that negative attitudes and behaviours are sort of really prominent. So when we do any of the studies, we look at experiences of care, we hear the story of people feeling devalued, whether it's in an ambulance, whether it's in the ED, whether it's in primary care, whether it's in other parts of the health service, people feeling devalued, dismissed or dehumanised. When we look at experiences amongst health workers, there's a recognition that there's a lack of awareness of this stigmatising behaviour and a lot of unconscious biases around how they respond to people without actually being aware that they're being stigmatising. And we also have this issue with therapeutic pessimism. So, largely what we see in the healthcare system is, why do I bother helping this person? It's not going to make any difference. It doesn't matter. So this reinforcement of the idea that people can never get any better. But, I think it's important to say that, we shouldn't rest on our laurels because even in our industry, we're quite pessimistic ourselves. So we did a study in Victoria looking at Australian alcohol and other drug workers' estimate of people in successful recovery. And what we know is in terms of people who are actually able to make sustained and positive recoveries, we're talking about over 60% of people in addiction, which is much higher than most other chronic health conditions, so it's a really good news story. But amongst people who work in the sector, they estimated it was 30%. So we've got this nihilism within our own sector, and that's obviously because of many of the people we see that make successful transitions don't stay in our system. We often see the people who continue to struggle. The good news is we're not as bad as Wales. Our colleague David Best, their estimate was 7%, so I don't know what's happening in Wales. They need to do a lot more singing, I think, to turn that around. But it just means that, we've got a lot of work to do in our own sector around being more positive and hopeful. We complain about everyone else, but we need to think about what we're doing in-house ourselves. There's this general issue, as we know, about lack of skills, lack of skills in managing and supporting this population. So that leads to anxiety and fear and a desire for avoidance. Much better if, I refer them over there, that they can deal with them. It's not up to me, always looking at bouncing them to other people. And and the problem with that is in the workplace, we have this stigma in workplace culture. So we know many of our colleagues across the healthcare system are going to be struggling with alcohol, drug or gambling issues themselves. But because of that culture and because of that stigmatising frame, they're discouraged to talk openly and honestly about that and to seek help. And, the worry is if they do disclose they're suffering with that problem, they're going to be perceived as less competent. So we have this whole stigmatisation with our own industry. And then when we look at stigma at the micro level, two great stories just to highlight this around that internalised stigma. So Brigitte, I know a lot of my heavy using because I was ashamed of what I was doing, and it didn't. Common sense approach would be to not use, but in my case it was used more so I could forget about how bad I was feeling about myself. So that recognition that what you're doing isn't helping, but there's a lot of emotional pain that you're trying to manage. I stuffed it up so many times with things, that's why I drank so as well. It wasn't to self-harm myself, it's just like I say, get drunk and stop thinking about what I'd done wrong and where I went wrong. So that issue of internalised stigma, public stigma leading to distrust, fear, stereotyping, discrimination, and that internalised stigma fueling ongoing drug use and delaying help seeking. So shame, feeling discouraged, feeling isolated and lonely, driving more drug use. So I've talked about sort of the framing of where we're at, sort of the impact of stigma, and I suppose the next part of my talk is, well, what can we do about it? How can we change that? So let's look at, what we can learn from other areas of health around reducing stigma. What else has worked? If we look at other stigmatising conditions, mental health, HIV, range of other different sort of conditions, what do we learn? Well, we learn that, because of the stigma, often people don't come across, even though they obviously do come across lots of people who are struggling, because people don't talk about it, nobody has that real experience of what the issue is. So that lack of contact fosters discomfort, distrust and fear. And it's not surprising that the most effective interventions against stigma and mental health stigma in this example is to combine personal contact with education. So providing factual information and connection to people with lived experience. And we find that those combined interventions are twice as effective as just providing information alone. So the UK ran a really successful campaign around time to change, and it was about pairing that information about the issue with people with lived experience. But obviously we can't mobilise thousands of people with lived experience to go to every workplace or to every setting, and so it's about, well, how do we have a much more broader impact? And this is an example here, the Let's Stop HIV Together campaign. So it's about humanising narratives. So it's about narratives that are about people being positive, successful, being active, participating in the community. So here we have these campaigns of real life stories, which has this broad reach and exposure, which is around situating the person sort of in real life. So I'm a devoted son, a singer, an artist, and I'm living with HIV. So lots of 20 different vignettes that they had, really successful campaign. It can really help connect that emotional connection with the audience. So really positive stories rather than the negative stories that we constantly hear about. We also know that increasing awareness of treatment and recovery has powerful effects. So, obviously when HIV was about, there wasn't much treatment, sort of really harsh, negative, stigmatising attitudes. And as treatment for HIV improved and the community became more aware of it, what you can see is that the belief amongst the community that AIDS was a punishment for a decline in moral standards fell from almost 50% of the population down to about 16%. And the belief that it was the victim's own fault fell again from about half the population to a third of the population. So we know if we actually tell people that treatment works, and I think it's fair to say in our space that is not the narrative that's out there in the community, we see a change in those stigmatising attitudes. And similarly, the work here in Australia, this work of Tony Jorm and around mental health literacy, showing that, again, those campaigns, largely led by Beyond Blue and others, about awareness of families, about mental illness and treatment, awareness of friends from experiencing depression in sharing those experiences increased from 44% to 71%, and self-disclosure increased from 23% to 44%. So if we tell people that treatment works, we show visible stories of recovery, we hear those positive messages, really good examples, HIV, mental health, where we can change attitudes around this. And again, evaluations, Tony Jorm's done a lot of work in this space around evaluating this awareness of treatment recovery from Beyond Blue campaigns, so associated more positive beliefs about treatment and benefits of help seeking, and an increased awareness of the discrimination that happens about people experiencing depression. So understanding in the community how barriers can impact on actually getting help. And again, this is another example of an HIV campaign from the US. HIV treatment works. I'm here, I'm living, I'm happy, so take that, HIV. So depictions of recovery can increase belief in the effectiveness of treatment in the general population. The more we tell that story, and the more we focus on explaining to people the barriers that people have in terms of accessing help, the more that creates compassion and understanding in the community. So if we explain that, that treatment does work, but there are these barriers, that's the story we need to start getting across. And not only does it impact on the community in that way, but it also impacts on internalised stigma. So getting people to actually tell their stories and supporting them to do that has been shown to create a sense of empowerment and boost self-esteem. So not only is it good in terms of changing community attitudes, but it helps people own their own story and feel positive in terms of making a difference. Nibla's just done a really great systematic review of addressing stigma in healthcare settings, and she and the team reviewed a whole range of studies over the past 5 to 10 years, looking at strategies of how you change stigma for HIV, mental health, substance issues, a whole range of different mental health settings. And really the key activities they identified was providing really good information, doing skills building around how you address this space, participatory learning, so rather than just sort of didactic learning, actually getting people to participate in activities around this, having contact with the stigmatised groups, so making sure that people sort of have those opportunities to mix with people with lived experience, an empowerment approach, so actually giving people in the stigmatised group sort of skills and knowledge about how to navigate the system and how to deal with some of the common barriers to accessing care and support, and that structural policy change within the healthcare setting themselves. And the important thing here to say that you've got to target it at every level. If you're just teaching the clinicians and you're not teaching the admin staff, then it's not a welcoming environment. So it's a whole of organisation approach, and sort of, a real importance of building that at multiple levels of the organisation, both in terms of policy and environment and different strategies. But really positive information about how you can actually change attitudes. So when we think about strategies to mitigate stigma at the macro, meso and micro level, I just listed a few examples of things that we can do. So at the macro level, it's about reforming laws, policies that create barriers to quality care, addressing institutional policies and systems that fragment care, increasing consumer involvement in serving planning and delivery, removing regulatory barriers. And I think, COVID, one of the lessons from COVID, particularly around opiate substitution treatment, is around, we freed up access to people when we said, oh no, things will go bad if we make it easier for people to access this treatment. And we didn't really see those outcomes. We actually saw really positive outcomes. And the challenge now is for how we keep those changes that we put in place around COVID now, rather than going back to the old model that we had. It's about having person-centered language in policy and population-based anti-stigma campaigns. And I'll talk a bit about that in a second. At the meso level, or at the sort of healthcare level, it's about prescriber-based education and training, expanding the peer workforce, the importance of having lived experience situated within healthcare settings. At the micro level, it's about contact-based interventions and skill building. So there we go, that's the solution. So let me just talk about some challenges to that and the challenges we need to overcome. So one of the challenges we have is there has been, I don't know, maybe people can correct me here, but there's been very few initiatives to reduce addiction stigma. Stigma reduction is identified as one of the 8 priority areas in Australia's 5th National Mental Health Plan. Amy Morgan did a review of interventions across this country in terms of reducing mental health stigma. As you can see, 55% on non-specific mental health problems, 21% on multiple non-AD related disorders, non-focusing on addiction, alcohol and drug issues. So we haven't had a campaign in that sense. So it's not surprising that stigma is so prevalent and prominent. The other issue, as you know, is, few people are willing to tell their story publicly. Stigma creates barriers to disclosing the problems that they are struggling with, fear of judgment from family and friends, potential impact on employment, shame and embarrassment, and obviously the mainstream press doesn't support you that well when you tell your story. And that contributes to low rates of help seeking. So 1 in 5 Australians are affected by substance use disorders in their lifetime, but only 20% seek professional help. And we see this long lag in treatment seeking, so a median of 18 years from developing a problem to first contact, particularly for alcohol. So we've got to change that. That's a really terrible stat, and I think that's something that we can get on board with in terms of how we reduce that. We've certainly done that around psychosis and mental health. We need to really sort of invest, and cancer, we need to think about how we shape the narrative around that in this space. The other thing we face is there's very few depictions of addiction treatment and recovery. We know that addiction is treatable. In fact, it has better outcomes, as I say, than most other chronic health conditions. Yet nobody knows that. The population doesn't know that at all. We often don't know that in our own sector. We have this siloed treatment that perpetuates stigma, so addiction is seen as different from other disorders. We have a focus on abstinence and cure as opposed to recovery as a process. And there's a real general lack of interest in outcomes, generally because, I think, it's seen as, well, let's give them money to do something. We don't believe it's going to work anyway, so we don't want to measure success because, this thing's untreatable is the narrative. So we have limited research investment in what works. We don't celebrate what works. We don't hear stories of success. And the system doesn't focus on quality and safety. And I'm just amazed in Victoria, for example, we have this whole office that's looking at safety in healthcare, big investment in looking at outcomes, how we can quality improvement. We have a chief psychiatrist office that's focusing on quality improvement in mental health. And in the addiction space, we have nothing. Nobody looks at sentinel events, nobody looks at deaths, nobody looks at how we improve the system. There's this sort of ignorance and distraction around this whole area. So we've got to bring this whole area back into health. We've got to have the same principles that we apply to every other health condition, to this health condition. And we need to tell the story, and we need to tell those stories of success, and we need to look at what works, and we've got to focus on improving all the time. That's what we need to do. And I think what's really challenging is, in my time, we run a whole range of helplines, including the helpline, the Addis line up here in Northern Territory. And there's never been a campaign to promote the fact that treatment works, that helplines are available. Never. I'm not sure it's been in the NT, but certainly in Victoria, the AADIS line, that direct line, the alcohol and drug line, never been promoted. Nobody knows that there's treatment there. Nobody knows that it's available. Nobody knows that treatment works. So we need to do a lot better, particularly when we see, the promotion of so many other helplines for so many other health disorders, for so many other social issues, family violence, a whole range of other issues now. Lots of promotion on that. Nothing in the space. We're silent. When we look overseas, Northeastern University has been doing an initiative around changing the narrative. So this is just a small sort of initiative, but it's about having academics, lived experience, sort of being in touch with journalists to try and correct some of the narrative, to try and help them tell their real stories. A real investment in trying to build connections with mainstream media to try and change that narrative. And really that takes us to sort of where we sort of enter this sort of journey. So we were approached by Blackfella Films to do a story. They do a lot of award-winning production company to do stories on addiction, and they do a lot of social justice stories, and they came to talk to us around, they were interested in doing something in the addiction space. And we had a good long conversation around what they wanted. And the initial idea they wanted to film people in a rehab over 4 weeks to tell the story of addiction. And I think one of the things that we talked to them about is the fact that, that just reinforces stereotypes, because you're going to see a particular stereotype in a rehab, depending on which one you look at. It's not going to look at the fact that addiction affects us all. You don't see that cross-section of society. It's going to reinforce the idea that you have to go to rehab to get treatment. We know that most of the treatment that people get and successfully recover from is happening in sort of community settings. And you've got to have a longer time frame. You've got to see the journey that people are on, and you've got to see that change, and you've got to situate it in the community and into their lives. So Blackfella Films came back to us and said, can you put together a treatment program that sort of over 6 months that talks about, what you think might work? And so we're able to work with them to really focus. The whole initiative was about telling those stories, giving people the opportunity to tell their story, to show that addiction affects us all, to show that stigma is disabling, to show that treatment is possible. That's what we want to do, and to focus on the lives of everyday Australians. And we're fortunate to be part of that documentary. I don't know if everyone's seen it here, but it's still on SBS On Demand if you haven't seen it. It was a finalist for the Walkley Awards, and I think it did a lot to help us talk about how we change the narrative about how we speak about this. So I just want to pay tribute to the 10 people, incredibly courageous and brave people who put their hands up to go on national TV and to share their stories with them. I think one of the things, when I talk about empowerment, what people were really clear who took part in that show is that they wanted to use their suffering or their struggles, and they wanted to inspire other people to reach out for help. One of the great things about being involved in that documentary was the attention it brought to this issue. So we saw lots and lots of stories in mainstream media around that time talking about this issue and talking about this in a way that was quite informative. Because we were involved with SBS who wanted to promote this heavily, we were able to work with them around a whole range of promoted content, in mainstream media, on podcasts. It was a really great opportunity to shape the conversation. And what was really fantastic, and very sort of unexpected to sort of some of the things that we're used to, is that when you look at the social media response that the program had, is that we had incredible engagement across the country, but that the bulk of the messages, almost all the messages were compassionate and supportive. So it really resonated with people, and I think the way in which Blackfella Films did a fantastic job in humanising the stories and showing that it can affect anyone and situating in family and community, it really resonated with people. And I don't know if, obviously it went out just as COVID hit as well. I don't know if that resonated with people about being isolated and making people think about their own health issues, but unbelievably positive feedback, which was absolutely brilliant. So on the back of that, we wanted to, we knew we were going to get this free sort of publicity through SBS. One of the things we want to do is to mobilise that opportunity and bring people together to call for a better response to how we think about and deal with addiction in this country. So we created this campaign called Rethink Addiction, which is really a national campaign to sort of advocate for a better change. And really it calls for addiction to be sort of identified as a national priority, that a summit of meaningful knowledge, that there's a national plan and roadmap to take this issue seriously. And we're really surprised that within a very short space of time, we had 40 organisations on board who came on board to support that campaign. And that's everything from the AMA and medical colleges, to the nurses, to health services, to unions, to ambulance services. And we're continuing to build that partnership now. This is an old slide. Pleased to see AADANT, one of the first organisations to come on board. But we're looking to build that out now. So we're talking to the banks, to the big four, to because we know that addiction touches so many lives, and we all recognise that we're all paying an enormous cost for the fact that we don't treat this issue seriously. And so we're wanting the whole of civil society to come out and say, look, we've got to go a better way. And pretty much in a post-COVID world where we've got enormous debt, we can't continue to fund an approach that's costing us all money. We've got to think about how to do this better. We ran an event in Melbourne to talk about the show. We had Dane Beams and Shanna Wan, who's now local hero, Australia of the Year, talk about their own personal experiences with addiction. And it just shows the level of interest in this area. So we were sold out pretty much in a few days. And it was interesting because I went to a conference in Tasmania to speak at a Tasmanian conference, and I was stopped in the market at Salamanca by a mother and her daughter who said that they come from Hobart to go to this conference because they found Addicted Australia sort of really resonated with their experience, and they wanted to make a difference and they wanted to come and be part of that movement. So it's really galvanised people interested in this area. So part of that campaign and building on what I've talked about here about how we make a difference is around sharing the real stories, combating what we hear in mainstream media. So we're asking people to share their stories, to tell the real stories, to really change the narrative around what's happening in the community. And here we have Vicky, one of our addiction psychiatrists. So when we say sharing stories, everyone's sharing their story, anyone who's touched by it. Consumers, family members, clinicians, policymakers, law enforcement, everyone's got a story to tell. And we're just about to launch a campaign. We're just working with an advertising firm at the moment, but we want to run a campaign to collect 1,000 stories. Everyone has a story, I think might be the tagline. We want to really hear the stories that everyone's got to tell. And the reason we want to take those stories is because we've got a national convention coming up on the 12th to 14th of September in Canberra. It's during the sitting week of both upper and lower houses. So we want to go to Canberra and we want to make a big noise. And the convention's around telling those stories. It's about bringing lived experience. It's about telling the story around why we need to change. And it's about making lots of political noise, hopefully for a new government to take this issue seriously. So part of it is encouraging all of you, to contribute either through storytelling or being with us on the day. Part of those 3 days is around telling those stories. We have the Department of Health who are helping to fund this, which is fantastic. But it's also, we have a Government Relations Day, which will be going and meeting with politicians, across federal parliament to talk about these issues and bring those stories to them. So a really important opportunity to really elevate the issue. So I'd really encourage people to get involved, and you can do that by signing our petition, sort of promoting the campaign, sharing a story, watching and telling people to watch Addicted Australia and get involved. And I'll just finish there by acknowledging all the great people I've had the opportunity to work with. Thanks so much for your attention.
I think we'll offer the opportunity for some questions. Anyone's got some things they want to ask Dan to elaborate on?
Dan Wilson from Alice Springs, outside of the, a traditional treatment participation program, do you stay in touch with the mob who participated in the making of the series, in other ways, outside of a participant and a clinician? relationship with Turning Point?
Yeah, I mean, I think people are on their different journeys. So a couple of them are really strong advocates in this space and see this as a, sort of a major focus of what keeps them strong and what they want to do. So I think that's been really empowering for them to feel that they've got a message to give and to feel that they can contribute. But I think that for all of them involved, it was that opportunity. Almost everyone was, they were looking for help for themselves, but it was about this wanting to make their struggle sort of meaningful. It was about this wanting to share it and wanting to help others. That was a major driver for all of them. And a couple of them that I still see, I won't say who they are, but tell me stories of how they're recognised and that people come up to them and tell them how they changed their lives by hearing their story and making them go and get treatment because they saw what's happened. And even in our detox, we had some really beautiful stories of people who'd watched Addicted Australia and watched it with their family and told their family for the first time, having watched it, that they had a problem and came into treatment. So I think it just reinforces what I've said in the talk, is that we've got to change the stereotypes that people see in the community. We've got to tell them that this is what addiction looks like, not what you see on film or in TV series. This is what addiction looks like. This looks like you. That treatment is available. There's lots of great treatment out there and it does work. This is how easy it is to get help. And I think that's the challenge for us all, I think. And I think, often we can all sit and reflect on how difficult this all is and the challenge we have. But I think in terms of telling stories, I think, that's a very easy thing for us to do, to think about rather than just constantly telling, the stories of the struggles we all have in working in the sector, is how we start telling those positive stories, how we identify pockets of really brilliant work that we have in the sector, how we really interrogate that, how we really tell people about this, what good treatment looks like, this is what we need to be investing in, this is what we need more of. I think we can all do that. So it's about how do we change our framework to being that much more positive and optimistic and really all come together as a collective voice, because that's the other challenge we have as a sector. We're incredibly fragmented. We're often, it's difficult for us to all get together. But I think having some sort of common sort of approach where we're all sharing stories and we're all bringing our collective wisdom together, I think can be really powerful.
So we did do anti-stigma here.
Oh.
They were on the back of buses, all three. Darwin, so that was AADANT with Sprout, Campaign Sprout, putting together the thing. And it didn't start as an anti-stigma campaign, there's more to treatment than rehab. And it was really powerful, and to this day, I still think it was great thinking going into that from AADANT and Campaign Sprout.
So you guys should write that up, because I don't hear that. I don't hear that in other jurisdictions, So that's really something to celebrate, and we probably do need to talk about more.
I guess the question I've got that kind of extends into both of those areas. So the Rethink Addiction campaign, I think, is really vital in changing that conversation and opening up the conversation about addiction and our response to addiction. The focus of our campaign and a lot of what our thinking around it is encouraging people to get into treatment and to recognise the need for treatment prior to getting really to the pointy end of addiction and trying to get that early intervention. Do you see much opportunity for the Rethink Addiction campaign to work into that space, into, you open the door about this is what addiction actually is, we're having an honest conversation about it, but how do we get people to recognise when they need to either self-intervene or help other people prior to getting to that point?
Yeah, absolutely. I think, we're on a long trajectory here. Just the work that obviously Beyond Blue and others have done in the HIV space, that didn't happen overnight. There was a lot, had a long tail to it. I think we're just on that, start of that journey. But I think the more we talk about it, the more we hear, real stories, the more we talk about what's available. When I came to Australia in '98, so I started working for Pat McGorry at Origin, and his big focus at the time was around early psychosis. So the big focus then was the fact that people waited 10, 15 years with a diagnosis of schizophrenia before they sought treatment. And then what we've seen now is that great investment in early intervention and the focus on early psychosis. So we've seen a whole quantum change in what's funded in that system around early psychosis, and the no-brain idea that if you intervene earlier, you're going to see less collateral damage and consequences of harm. And that's the problem we see. I mean, often people who come into our treatment services, they're coming with 15 years of collateral. They're coming with physical, mental, social sort of consequences of untreated illness. And we've got to see people earlier. So I think the more we talk about this, we've seen it in cancer. I mean, I tell this story when I speak to philanthropy. So, when I started my medical career, I used to see, as a medical student working in surgical clinics, used to see women present with end-stage breast cancer. Very intelligent women who delayed help seeking because the idea was there was no treatment for cancer, and that it was seen to be in some ways personally responsible that people who develop cancer, this crazy notion. So cancer used to be highly stigmatized when I started in medicine. And now we see pink test matches, we see messages of hope, we see a whole sort of quantum change. So in my lifetime, I've seen change in cancer, change in depression, change in a whole range of areas. There's no reason, we can't see a change in this space. We just need to think about how to move in that space.
Given it was so successful, the show, is there plans to do it again or an extension of it?
Great question. I think we're very fortunate to do what we did. So I think one of the issues was it was on SBS because SBS would be the only TV station that would do something like this. I mean, if it was on any other channel, it would have been sensationalised in a very different way. So, we were lucky, that SBS agreed to make it. The challenge was because it was on SBS, didn't get as widespread sort of pickup as it could have done, seen by sort of millions of people, but not, everyone I think who sees it, it does change their perception around this issue. I think the challenge for us getting into the series is that, particularly post-COVID, everyone wants positive storytelling at the moment. So positive stories, and so I think there is and I think because of the stigmatising content, I do think it means that people are less likely to pick it up. So yeah, we'd love to do some more series, but I think we were lucky to do it when we did, and I think the stigma, makes it difficult for TV companies to pick it up. But who knows in the future what we might see.
Well, just a very small feedback. I watched the whole series, and I have a family member who has a long history of very big stigma towards addiction. But because I always had a different perspective, I never tried to push things too much into that particular person, and especially since I started working in this field, I said, okay, that will be my sounding board. Like trying to send some information, not just imposing information. And I've been noticing some changes over time. But I remember when we were watching, I invited that person to watch this with me. Just said, oh, this sounds really interesting. Do you want to watch it with me? Just see what it is. It's about Australia and so on. And because we are both from Portugal, but there's a long history of work around addiction and then have new policies in place. He goes, oh, okay, let's watch it. And the first comment was exactly one of the participants, I can't remember her name. He was saying, I would never say that person was suffering from addiction. And he said, okay, that's something. So I could start seeing that stigma breaking down even more further down through the series. And it was really interesting. And again, I try not to push too much information, just give him time to see how things develop, and now I see he works in a very where there's a lot of toxic masculinity, so like lots of support towards drinking, and it's not a very healthy place to work on. And now I can see him starting being active towards his colleagues, saying, really? Do we really need to go and drink every Friday until we, like, it's starting to take action. It's really, really interesting to see the change. Of course, it's one person. That's why I'm saying it's a very small feedback. But if we look at the big picture and the broader picture, I think, it's really about breaking down the stigma and trying to show people that, it's not about people just in the corner. It's anyone around us, basically. And just a feedback.
No, thanks for sharing. And I think that's what we were amazed with the document. I mean, we had so much feedback from people, and so many people reaching out to talk about exactly those sort of experiences, but also, to talk about what's possible. And I think that's the issue. We've got this whole sort of hidden population, who don't know where to go for help, or who to talk to, or what's going on for them. And I think, how do we mobilise that? How do we tap into that? Because it is so common. 1 in 5 Australians are touched in some way. We need to sort of think about how we bring our collective efforts together to make change. And it's great, and that's a really great example how, it doesn't take much to change people's perceptions.
Yeah, but again, I don't think it's about forcing things, because I saw that happening in the past in the big picture, and things didn't go well. And again, I grew up in an environment where there was a lot of in the community I was in, there was a lot of higher rates of drug use, and I got through the 90s where there was a big change in the policies in Portugal and so on. But when people were forced to do things or to change their perspectives, that didn't happen. So what I see is, if you show things how they are, with the good and the not so.
For me, it shows how one documentary can have, impact. What happens when we start, doing that more and more, and we have lots of examples of that, lots of those conversation changes, how much difference we can make. Hey, Cass.
I was wondering, have you had conversations with universities and training providers around integrating some of this kind of material into healthcare workers' courses, for instance, like given that we know that stigma is such a barrier into accessing healthcare? So I taught a course that had a lot of similar kind of content to the first part of your talk for La Trobe University, and it was only contained to health sciences students, but it was really remarkable the change that you saw in open-mindedness and reduction of stigma in one class of students kind of at a time. And speaking to people who I know who are kind of doctors at the moment, and they've noticed that they're certainly seeing still a lot of stigma from people who are only newly graduated still. So I'm kind of thinking there's obviously a lot of room for it to be included in a lot of healthcare workers' courses. Any discussions started about that?
I think it's excellent observation, and I think that's the challenge we all face, isn't it? Because addiction generally isn't taught well in our undergraduate and postgraduate courses, and I think thinking about how we look at having that lived experience perspective in those undergraduate courses are really valuable. So, we're having conversations with a whole range of our local universities, but, it's thinking about how do we do that, at a state level or nationally. I think it's really important. The Howard government for a while, invested quite a bit of money into medical curriculum, so actually had a dedicated focus in the 80s around ensuring there was addiction content in medical curricula. Unfortunately, that funding ended, and many of our courses don't have much content in there, and so the first time people experience people with addiction is sort of in their clinical settings when they've really got no context and they have the same sort of attitudes as the general population. So I think there's a lot we can do. I mean, I think, we're talking about what we're doing here, but I agree, the next generation health workers, that's where we need to focus, and we need to think about what are the initiatives that we have in undergraduate programs and TAFE programs and others. We've just done Michael Savick, who works for us at Turning Point, did a brilliant study working with Vic Health around hospitality workers and male drinking cultures in hospitality. I encourage you to go and look at those video. So we interviewed a whole range of male hospitality workers and talked about the culture of drinking in hospitality, and created a number of animations based on those stories. And it's actually those people telling their own story. It's really powerful. And so it's about, getting into those curriculums and changing the narratives, I think are critically important. And any opportunities for funding to do that, I think we're all welcome.